Sorry, I was late, Chair.
That's fine, Councillor Cooper. We are late starting this evening. Just to remind everyone that you do have to use the microphone, and also to remind everyone so that we can all hear, because I can't hear unless people use the microphone, and also that we do need to turn the microphones off after you've spoken. Thanks very much. So do we have any apologies? Just the one apology for being late? No, none others? Thank you. We don't have any late items. Do we have any declarations of interest? No, thank you. Are we all happy with the minutes of the meeting held on the 30th of November? Yes, thank you very much. Okay, right, that takes us to our first report, which is our usual COVID update from Robin Dewis, who is the Director of Public Health here in Derby. And just to explain to everyone too that unfortunately our usual scrutiny officer can't be here this evening. So because of that, I think we're not going to be able to show the reports on the screen. Is that right? So apologies for that. So I hope everyone can find their reports on their own computers. Thank you very much. So Robin?
Thank you, and my apologies because as usual we've got some slides, updated slides, so they can be circulated after the meeting, Chair, and I can just talk you through exactly what's on the slides if that's okay. So just to update on where we are with COVID at the moment in the city. So our latest data, which is reported up to the 26th of January, gives us a case number of 2,782 cases in the previous week, which is a rate of just over 1,000 per 100,000, 1,083 per 100,000. And what we've seen, obviously, is a really steep increase over the Christmas and New Year period, where we were over 5,000 cases a day, and then a week, apologies, over 5,000 cases a week, and now we've declined down to 2,782. But what we have seen in recent days is that case rate has started to increase a little. Certainly not as steeply as it did before Christmas and New Year, but it is just showing a little bit of an uptick. And when we break that down into the age groups, we can see that particularly the primary school age group, the 5 to 11s, are increasing quite significantly, and the outbreaks that we're seeing within primary schools are much more significant than they have been. We're seeing a bit of an increase in secondary school age children and also in preschool children as well. But it is not unexpected that we see that increase in the primary school age children, because obviously we've got very small numbers who are vaccinated within that population. The other thing to just update you is that yesterday we had an update in the national data. What has been happening is that individual positive PCR test results have only been reported for an individual's first positive result. So since the beginning of the pandemic, if you had more than one positive result, any subsequent results weren't recorded within the national data set. This was established really early on because people were having multiple tests sometimes, and it was skewing the data. But obviously, as time has gone on and the possibility of reinfection has become apparent, that's become an issue. So yesterday, that data was updated, and we've had chance to have a brief look at the data for the city. And what we've seen is around a 6% increase in the cases reported over the entire period of the pandemic. But clearly, the issue around Omicron and reinfection has been so much greater than with the previous waves that we've had. And in the latest week, there's been about an 11% increase in the data. So we've seen around 11% of the cases in the past week have been reinfections with Omicron. So we have a chart that you will be able to see just to illustrate this. But I think it's really good news that we're getting some better information through on that, and that's going to be more helpful for us. So just just to update on the key points, so our cases are very much broadly distributed across the city at the moment, but as I said, not broadly distributed amongst the age groups. It's particularly in school-aged children, particularly mostly within the primary school-aged children. We are seeing a small increase in the group of parents of those school-aged children, that age group that would be parents. And as I said, a smaller increase in secondary school. And secondary schools are currently having the rollout of the second dose of their vaccination for the 12 to 15-year-olds. But that's in process and is going to be happening through February and into March as well. So we'll be a couple of months before that vaccination programme is completed. There are still significant hospitalisations for patients with COVID, but we have noted recently that they have stabilised. So there was an increase and then we've had a stabilisation. And we're just watching the national data because in the southeast there are reports now of a slight increase in that hospitalisation rate. So we are monitoring that. And just to say about vaccination as well, we have, working with the NHS, there's a roving offer of vaccination that's being rolled out this week, and that's particularly to promote the first and second doses, so those individuals who haven't had any vaccination to date, and that's being rolled out through this week. So just a brief summary of what we're anticipating for the future. So we are anticipating that we're going to see an increase in the case rates in the short term, and that relates to the school-aged children, and also our move from Plan B back to Plan A as well. But we are certainly hoping with the level of vaccination and also with the immunity that this wave will have created within the community, that we are hoping for a general downward trend then towards the summer. We have the benefit of the seasons as well, becoming spring and being able to be more outdoors. So we are hopeful that will happen. Obviously, a new variant in the mix would potentially change what we'd expect to see, but again, we wait to see what happens with that. We're currently waiting for a national review of testing, contact tracing, and what the national COVID policy is going to be. So we're uncertain after March exactly what the approach is going to be. And we are also waiting for the confirmation of any funding after March as well to see. This is particularly relevant because we have our local contact tracing team here working with us at the moment, and we're waiting to see what the policy is going to be around contact tracing generally as well as local contact tracing. So that's my brief update, but I'm very happy to have any questions on any of that.
Thank you very much, Robin. Any questions? Councillor Froggatt?
Evening, Robin. I'm just wondering are you looking to see any repercussions from Saturday's march with Derby County? And also, because it was a full stadium at Pride Park, there was no vaccine passports asked, and they also put on social media that masks weren't needed. So are we expecting any more cases to come along?
So I think there's been that general change, hasn't there, in the advice, the move from Plan B to Plan A, and I think that's across the community. It's within all settings, isn't it, that advice has changed. So we are just monitoring the data, and we just need to wait to see what comes from that. But we are aware, as I said, not just the issue with the unvaccinated children within schools, but also within that change, we may well have an implication for an increase in cases.
Thank you. Councillor Lonsdale?
Hello. Two questions. Are there any variants that we're a bit concerned about that are coming towards us? And how are people getting on with developing a vaccine for children, since children are the issue, not being able to vaccinate them at all when they're little?
So there is a particular Omicron variant that's being monitored at the moment, but there isn't anything that we'd be particularly concerned about. There's an ongoing monitoring of all variants. So it just really is waiting to see what happens with that data. From the 5 to 11s vaccination, at the moment it's being rolled out for 5 to 11-year-olds who are clinically vulnerable or who live in a household with someone who's particularly vulnerable due to immunosuppression. So that group of 5 to 11-year-olds are being offered the vaccination now, and the JCVI will be reviewing the information around the 5 to 11-year-olds generally to consider whether they should be vaccinated or not. It's very much taking into account all of the evidence around the benefits of vaccination as well as what's happening around in the community as well.
Councillor Cooper.
Thank you, Chair. I've got a couple of questions. I think on this occasion I'd like to be quite focused on the council and its service delivery and other issues around how the council delivers its core service. So I was watching a television report from the Royal Derby the other day, and it was talking about potential that NHS staff won't be mandated to have the vaccination and that they won't lose their jobs. Transferring that to the council, I know we've got a number of care homes or other sort of similar environments. Have any people left because they don't want to take the vaccine? Has it impacted service delivery? And I'll start with that one if that's okay, Chair.
So just on that, from our perspective, we've got the care homes where the vaccine mandate came in before Christmas, and so that has been implemented. The home care services are alongside the NHS discussion as well. So that hasn't yet been implemented from a home care service perspective. I don't have the detail around whether we've lost any staff through that, but we can certainly find that out for you. I think there's just a general observation that social care is incredibly pressured at the moment. There are many vacancies, and as you know, a lot of the care home provision across the city is delivered through the independent sector as well, and there are huge problems with recruitment and retention within the sector generally, as you'll have seen nationally as well. So we do wait to see what happens with the consultation around the NHS and home care provision, and then whether it's extended to relax the legislation around care homes, but we haven't heard yet whether that's going to happen.
Thank you, Chair. The next one's around the guidance within the council. With things changing within the national policy guidelines, especially for England, things are changing at a pace going the other way than we saw at the earlier onset of the pandemic. What stakeholders are the council working with for new guidance for staff coming back to the council house, working at Stores Road, other satellite based locations for Dorset's council staff, and those working within the community as well? Is that guidance changing? Who are you working with to make sure that it's the right guidance for the city council? And then on a similar vein, I recall we had a number of, I remember one piece of guidance coming to us as councillors about attending meetings. So for example, you shouldn't attend a meeting if you have people that are not well in your household, that kind of thing. Is that guidance still live now? Is that under review? And can you just give us a walk through that, please?
Just on that specific piece of guidance, that was highlighted that was in there. That was the guidance that was from May last year, and it was highlighted that was in there. So that was forwarded to our policy review group last week, our COVID policy review group, so that they could review that guidance and the risk assessment associated with it as well. So that is in process of being updated at the moment, because it clearly wasn't. It hadn't been updated in view of the national guidance. From the workplace's perspective, those risk assessments sit with the health and safety team. And although the national guidance around COVID has changed, COVID as a virus sits under the COSH regulations from a health and safety perspective. So there's still a requirement, even if there were no national guidance around COVID, to have that health and safety guidance in place from a workplace perspective. So the health and safety team are constantly reviewing those risk assessments from areas as well to ensure that they're updated. I'm sure you understand it's quite a large task with the speed of the changes in the national guidance, but that is constantly underway.
Thank you, Robin. So, as of today, if someone, I'm very lucky that no one in my household is unwell. I'm very lucky in that regard, and you know, we've all had a real reset in our thinking, I think, as a society about, you know, wellness, health. So if someone was ill in my home now and I was living with them, would you advise me not to come to a meeting as of today?
So what the national guidance says is that if you're fully vaccinated, so that's double vaccinated, the national guidance is advising you to take daily lateral flow tests and to take those lateral flow tests before you leave the house for whatever event. So if you're going to work in the morning, to take it in the morning before you leave the house, or if you were leaving the house for an evening meeting, to take it before you leave the house in the evening to ensure that they're negative, providing that you don't have any symptoms. So if you don't have any symptoms and you're fully vaccinated, the guidance is to do that lateral flow test. And then whilst you're out, obviously, within a meeting setting, to use face coverings and to follow all of the other guidance that's in place. The guidance that's in place from a workplace perspective is designed to ensure that it's a COVID-secure setting, which means that even if someone were unwittingly positive, infected for COVID, that the other people within the meeting setting would be protected. That's the aim of it, is that it would prevent any transmission, even if somebody unwittingly attended who was positive. As you know, with the numbers of cases that are so high in the community at the moment, we really need that regular lateral flow testing to help us to indicate that. Does that answer your question? Yeah.
I think, I don't know if I speak for others on the board, Robin, but I think Councillor Cooper raises some good questions there. And I think that is an interesting point about just how clear some of the current guidance is. And given that we do actually currently have rising cases in Derby, we still have something of a crisis going on. And yet I think my sense is that I think we're all aware that we're no longer required to wear masks, and we're all aware that we're heavily advised to have both the vaccinations and the booster. I think that's really clear. But beyond that, I think some of those nuances are not very clear, and I don't know if you'd agree with that. And I suppose, or I imagine that you are still putting out messages to people in the city to try and give some clarity on that situation, are you?
Yes. The answer to that is yes. And I think one of the issues of quite significant confusion is around when to get a lateral flow test and when to get a PCR test. And we've been trying to emphasise that message that if you have symptoms, it's a PCR test that you need. And the lateral flow test is to use if you don't have symptoms, and it's for regular testing. And as we just discussed, if you're a contact, to do that regular daily testing as well.
So, if you'll forgive me, everyone, but I was recently told by a fellow councillor that the PCR tests are quite difficult to access in the city. I mean, I don't know if that's the case. I mean, I literally myself wouldn't know where to go at the moment. If I've obviously not been in the situation, touchwood, fortunately recently, where there's been any need for a PCR test, but I actually don't know where to go. I guess I could look that up online, could I? But, you know, is it clear to people, and are those tests still widely available, please?
So if you go onto the web portal to book a test, or you dial 119, which is the number to call, then if you put your address in, or you say your address, it gives you an option as to the nearest available testing sites. In the city, we've got our two local testing sites that are fixed. So we've got one at Morleston and one at Sussex Circus, which are the two fixed sites. And then we've also got a mobile testing unit that we have had that's been both at the cricket ground and also at Pride Park. Over the Christmas and New Year period, there was a real challenge with accessing PCR testing. This was not about our local availability of appointments. This is about the national lab capacity. And there's a system within that booking system that once the national lab capacity reaches its ability, then the system will push people onto the following day. So we had some days where there was less than 80% of our local appointments booked, but you couldn't book any more that day because of the lab capacity. That's improved greatly since the move to not having to get confirmatory PCR for a positive lateral flow test. We've got plenty of capacity for those tests within the city. So it is easy to get appointment, and also you can get the test delivered to your home as well, and you can still do that.
So I just have a couple of questions. I don't know if anybody else, before I ask my two final questions, anybody else? Councillor Grimmadell?
Yes, thank you, Chair. Good evening, Robin. It's a general question, really, because there's thousands in the city that have had the vaccination, 2 jabs and the booster jab, and for protection against the virus. But does the protection diminish as time passes by?
So yes, that's our understanding, that our immune response, both from an infection and also from vaccination, will diminish over time. And this is something that is being considered nationally, to consider whether there's any further boosters that might be required by particular groups of individuals, or when that might be appropriate to do. So yes, we anticipate, in the same way that your immunity to flu wanes, then also immunity to COVID will also wane.
Can I just ask then, would you know the length of time before it does really diminish, where we have to then go again for vaccination? I mean, is it 10 months or a year, or are we heading for herd immunity?
And I think that's the challenging question that I think we don't yet know the answer for. So the original decision to boost after 6 months was based on evidence around waning immunity. But the pulling that forward to boost up to 3 months was also saying that immunity is starting to wane after 3 months, but also because we had the urgency of the Omicron wave. So without the Omicron wave, we wouldn't have pulled that forward to 3 months. But I think there's still a significant level of uncertainty around timings.
Thank you. So I just wanted to ask 2 points, really. You told us the number of cases, but I wonder if you could comment on the death rates, the number of people who are dying locally in Derby, and also, what is the impact of the number of cases on the Royal Derby at the moment?
Apologies, I'm just looking to see if I've got the latest deaths, as I didn't have them in the presentation. Just from an impact on Royal Derby Hospital, there has been an increase after the New Year period of admissions, but that has started to decline and started to level off, and has in no way reached the level that it reached in January last year. So admissions have been reduced, and the general feedback has been, although we don't have this as data, but this is the general feedback is that the length of stay has been shorter, the requirement for oxygen has been less, so that people have been able to be discharged more quickly. I've just got the latest deaths. So 2 deaths in the week ending the 21st of January. So, and over the last month or so, it's been 5 was the most that we had. So, it's really significantly less than it was at this time last year.
Right, thank you very much. Any further questions for Robin? Well, thank you for coming along again this evening, Robin. I know this is a standing item for our board. I look forward to it not being a standing item on our board, but it looks like, certainly our next meeting, I think, is not till April. But it looks like we probably will. We would like you to come and give us yet another update in April, please, because obviously what we're hoping is that we can see a way through and out by then, but it looks like there's an awful lot of uncertainty, both in terms of whether we're going to face another wave and also in terms of what the funding will be and what the plans are for the whole situation after March. So we look forward to hearing more about that then. Thank you.
Thank you.
Thank you very much. So now we have a presentation by Berenice Groves, who is the CEO, Chief Operating Officer at Chesterfield Royal Hospital, on Urgent Treatment Centre. Thank you.
Is that working? I'm not used to all this technology. So if I can just explain, and thank you very much for inviting me along tonight, why the heck you've got the Deputy Chief Exec of Chesterfield Hospital here tonight. It's because of the way that we're now working as part of the integrated care system. We have developed a number of delivery boards. One of those, which is the Urgent and Emergency Care and Critical Care Delivery Board, and I am the SRO, the Senior Responsible Officer for that, with the Chief Exec from Derby Hospitals, which was Gavin Boyle, and now Magnus is acting up into that position. He's the accountable officer. So that's why I've come along tonight, just to talk about our position. First of all, want to kind of bring our apologies and not apologies due to the fact that we have had to pause the programme. So you'll see from the report that you've had in your papers that we have a significant piece of work to do around the review of urgent and emergency care services, which includes our urgent treatment centres. But due to the operational pressures and certainly redeployment of many staff that have gone to support with the vaccination programme, we haven't been able to progress the work quite as quickly as we would like to have seen. That said, we have commenced with the engagement work, and the surveys have been sent out. They were 2 weeks delayed actually going out, but we've already had 369 completed surveys returned. We've got 133 who've registered an interest to take part in focus groups to give their views and just have a bit more in-depth input into what the urgent treatment centres look like as we move forward. We've got 8 invites to both the voluntary sector and community groups, and they're over February and March. 6 of those who've already been booked in, we've got dates for, and we're just waiting for the other 2. And there is a focus group already arranged face-to-face with the deaf community as well, which is really positive. That's going to happen in March. There's also a visit planned for each of the urgent treatment centres just to gather more information. Dr. Paul Wood, some of you might have heard of, he is linked into the CCG, and he is the clinical lead who is leading on this piece of specific work around the urgent treatment centres. And the plan is, as you're aware, we've got 5 that are out in the community now, 1 certainly that's in Derby City. We also have 2 that have been established as part of really the response to COVID, where we saw probably more increased presentations just coming through our emergency departments, and rather than asking people to move away and go to different environments, we created co-located urgent treatment centres. So we established those during the pandemic, and they've been extremely successful at helping with some of the flow of patients that are coming through those departments. So we've got a review of 7 urgent treatment centres that's underway. And obviously, who knows what the outcome might be. We might decommission some of those urgent treatment centres. We might decide, in line with what primary care wants and the new PCNs, that we may need to increase the access points for the public moving forward. Some timescales, because that wasn't included within the paper, is just to let you know that now we're back on track again, and we have re-established the programme. As you've just heard from Robin, we're starting to see the operational pressures settle down slightly. We're working on having a specification ready for May time, looking for kind of soft market testing around June, and then any tenders will be around the October time this year, as long as we don't see any other increases in pressure and the level 4 incident re-established. They will be the timescales that we're actually working to. So I'll stop there. I'd rather kind of take questions and answer the detail if I can do. Thank you.
Okay, thank you very much. We have had quite a few people from Chesterfield actually come and talk to us. You are not the first, so thanks for coming. But it might help if you bring the microphone up, please, a bit closer to you.
Sorry about that.
I think I could.
Doesn't help because I've still got my mask on.
Yeah,
sorry.
I can hear you, but it will help to make it a bit louder. Thank you. So, do we have any questions, Councillor Froggatt?
Hi, thanks for coming. It's a bit way out, to be honest, but the treatment centres, I have never visited one. You know, I'm quite healthy. What is puzzling at the moment is the dentists are now removing all their NHS patients. And, you know, obviously people can't afford private dentistry and all that. Do the centres actually cater to dental treatments? Yeah?
Yes, they do take dental injuries through the urgent treatment centres currently. It's not recommended because obviously the best outcome is for them to go through their own dentist. But as you say, there's some pressures on that at the moment. So another part of this work will be that we'll actually look at what provision is available across Derbyshire and Derby City.
Yeah, I think for the future it will be a lot, as I say, because, you know, the fuel bills are going up, this is going up, that's going up, and if they can't get NHS dental care, then they are going to be coming in droves.
Yes.
Just for the simple things.
Absolutely, and we do recognise that, yes.
Councillor Hussain, thanks.
Just a very quick question. I was looking through the report and I couldn't see where Derby's UTC is located.
So you have what's named the DUCT, the Derby Urgent Treatment Centre that's in Derby City itself. That's provided at the moment by one medical group. So there's a number of different providers that provide these centres across the whole of Derbyshire, and yours is one medical group, but it is in the city centre. Sorry, you can tell from my voice I'm not local and I haven't had the opportunity to drive around.
I think it's the walk-in centre on Osbaston Road. Yes, yeah.
Some time ago, one of the things that we did was we changed the nomenclature so that everything was called urgent treatment centres, and this is part of the work to make sure that they are delivering to one consistent specification. Yeah.
Councillor Pegg, can I just make a comment before I bring you in, because I think it relates directly to the conversation that's just taken place. So I think the comment, I've got a couple of comments, but one comment I was going to make myself, which the report sort of acknowledges at the beginning, is that it is quite confusing.
Yeah.
we have walk-in centres, we have different services offered by GP surgeries, and now we have the urgent treatment centres. And I think, as you've just acknowledged, the naming is confusing, and I know that Councillor Hussain knows the Osmondson area, the walk-in centre quite. You're very familiar with that service, aren't you, Councillor Hussain? And so the fact that Councillor Hussain, who used to chair this board, didn't know that that is now called an urgent treatment centre is quite telling. And if he doesn't know, then I can tell you that the vast majority of the city won't know. And I suppose, I think, that is a point to note that you do acknowledge in the report, but I think we do need an awful lot more alignment of services in certain locations and clarity about what locations and what services are offering what and who should go where and when and how they access it, because I think it is becoming increasingly unclear to people, particularly as Councillor Froggatt was indicating, that there's often difficulty in accessing all sorts of services, so people are just turning up here, there and everywhere. So it's still, I don't know if you want to make a comment on because for example, what is the strategy for the UTCs? I mean, for example, now that the one on Osmondson Road in Derby is actually UTC and not a walk-in centre, what does that actually mean in terms of the service that you're offering? Is it expanded? Is it slightly different? Is it more streamlined, more focused? What is it? And how will you be letting people, the public, how will you be bringing clarity on this to the public? Thanks.
Thank you. I think you've hit on a really key point here about the communications and how we engage with people. So you're absolutely right. These services have changed their names so many times. We've had minor injury units, we've had walk-in centres, we've had urgent treatment centres, and it just becomes really confusing. And NHS 111 was meant to take some of that confusion out of the system for people, so that if you called 111, they directed you to the most appropriate service. One of the areas with the urgent treatment centres and moving everything that's outside of hospital to that name is that there will be an increased specification. So we will be looking to provide better diagnostics so that people can kind of be seen as a one-stop shop. It's not a case of going and having your consultation and then having to go to a hospital to have some of the diagnostics taking place. We'll be looking to provide services such as that, so that we see that expansion, and it helps people understand that they can use out of hospital services as well as in hospital services. We will be looking at, because there are still 3 walk-in centres that are around Derbyshire, so again it'll be part of the strategy is that we look to have the one consistent name, so people are very clear on what service it is that they're going to see, and what type of services that they will experience when they're there.
So if you just don't mind, Councillor Pegg, if you just bear with me for a second. I mean, I hope I'm not taking your question here, but so thank you for that. But it's still not entirely clear to me what it is you're aiming at with the urgent treatment centres. You know, is this because I think many people were going to the walk-in centre when they couldn't get an appointment with their GP, but they didn't feel it was an A&E scenario, or they were, maybe they didn't know. And frankly, and I've said this before in this position as chair, NHS 111 is often extremely unhelpful and not very useful. Okay. So I think people were just walking in then. But urgent treatment centre sounds like it's somewhere you'd go, I don't know, if you cut your hand, you know you're not going to bleed to death, but you think, do I need a few stitches? I don't know. I mean, sorry for a rather crude way of articulating that, but can you just spell out for us a little bit more now what the difference is, what you're aiming for in these UTCs?
So we absolutely are aiming for making sure that patients know exactly where they need to go to. I recognise what you're saying about the walk-in centres, that you feel you can just walk in there. The name just it sounds like you just walk in there. But what we're trying to do is control some of the demand that's coming through, so people don't have to wait as long, that they're seen quicker and that they're seen in the right area. So I recognise what you're saying about NHS 111. We have had feedback such as that, but we are encouraging people to use that service so that people can get booked into the right service the first time. So the urgent treatment centres, absolutely, it's not life-threatening, but it is something that you feel it just can't wait. It can't wait for the GP the next day. You know, you need somebody to see it, have a look. You might have twisted your ankle, but it might be a break, so you might need to have that x-rayed. Absolutely, you would be booked into an appointment in the urgent treatment centre. The other bit is just to recognise that even though we're using an appointment system at the urgent treatment centres, we won't turn anybody away. So if you came to the doors as a walk-in patient, you would still be clinically assessed and put into an appropriate time.
Okay, thank you. Yeah, that does clarify it a bit for me at least. Anyway, sorry, apologies, Councillor Pegg.
That's okay, thank you. The survey, who was it shared with? It's been shared with locally, but who has it been shared with?
It's been sent out as a survey monkey through our communications department. So I understood it's gone out wide to all voluntary sectors, all community groups, and I understood that it had gone out to all of yourselves. Yeah. So I can check that for you though, just to make sure.
Yes, I wonder how wide the circulation was primarily.
Yeah.
Thank you.
Before I bring in Councillor Cooper and Councillor Lonsdale, if I may then follow through on Councillor Peck's point, because I think that is a very good point that he raises about the surveys. I mean, with respect, I think given that we're talking about now 7 UTCs, I think the number of respondents you've had is very, very small. This is the first time I've seen these surveys, reading the report tonight. So could I suggest that that more effort is made to distribute these, because I don't think you've got a very, very good response to that, and I just don't know that people are aware of this. That's my impression. People can tell me I'm wrong if they disagree, but they're not aware. And very quickly, before I go on to Councillor Cooper, if I may, I did read the survey, and you are asking for feedback. So this thing about the naming is very important, about consistent naming, as you know, and you've indicated. So one of the questions on your survey actually says, would you go to a UTC or would you go to an ED or emergency department? Now, again, I've been very fortunate. I have to confess, I haven't been to the Royal Derby recently, partly because I have ill relatives, but of course they've been kept out of the hospital because of COVID, and I haven't needed to go there myself recently. Perhaps we should actually, something the board should just go on a visit to the Royal Derby. That may be something we should do, because I feel I've not been there for a long time. But I don't know what it says over the door, but emergency department, I mean, everybody I know refers to that as A&E. I presume you do mean A&E. And the problem I'm having is that, I'd be welcome other councillors' views on this, but I mean, if you're trying to send this out to a group of people, I don't believe that calling it an emergency department is helpful unless I'm out of date and you've already got this in all the names at the hospital or something. So I think that's confusing for people. I think people refer to it as an A&E.
Thank you for that, because I often slip back to accident emergency and A&E. It's certainly the name that I learnt when I first started working. But it was probably back in 2002 that they changed the names, trying to really push emergency, the word emergency, and it is emergency department above all of the doors. But I do take your point, because we could easily put in brackets accident an emergency, couldn't
Yeah, I suggest that on the survey you do put, okay, apologies for, I mean, what am I, 20 years out of date, but there you go. Well, I have been to the A&E in the last 20 years, but of course it was under great stress. One time I thought I was having a heart attack, so I did not read over the parties.
And as I say,
okay, it's a fair point, but if you could put in brackets, because I believe that most people still refer to it as A&E. So Councillor Cooper, please.
Thank you.
Your microphone. Councillor Martin, I would never accuse you of being 20 years out of date. I would never ever comment on that. Others may. So yeah, I mean, if I jumped in a taxi now, bust my ankle, take me to A&E. Yeah, I didn't know it was. Yeah, I'm 20 years out of date. So, but yeah, so Urgent Treatment Centre, another acronym UTC. I didn't know also that it was no longer a walk-in centre. I've camped out there on numerous occasions, at the one we were talking about on Osmaston Road. I'm glad to hear that, you know, you guys are trying to streamline things. It was manic when I went. You know, it was crazy. You know, 4.5 hour waiting times and stuff like that. It was crackers. So that's positive. But I have to agree with Councillor Martin. Urgent treatment centre. For I'm a lay person. It's just a play on words. It's a walk. It needs to be something like a walk-in centre because, in my view, just my view, if we can keep people out of A&E, the emergency department, as much as we can by triaging people, and because we have to deal. We're in reality, aren't we? Not everyone rings 111. Not everyone does. They whether a child's injured. Whether they get scared. I've been in the same position as Councillor Martin. I collapsed once back in 2018 and I just wanted to go and see a doctor, so I went straight to A&E and I was looked after really, really well. When you're in that situation where you're trying to, you know, protect a loved one or whatever it is, you just want to make sure that they're in. So my actual question, you did answer earlier, but just for clarity. So say I presented with Councillor Grimmadell at the UTC and he was not well. Would they give him a once over and say, yeah, we're going to have you, we'll book you in now, you're going to get sorted, we'll take you around the back, we'll sort you out? Cool.
And can I just add that I totally recognise people kind of relate to different names, but there was a huge consultation that was done about 8 years ago, and that's when they came up with this. They agreed with Urgent Treatment Centre at that time. I think there was a lot of us that felt that the walk-in centre title was just felt easier and more appropriate, but that was nationally that was what they came out with. Just trying to get 111, Urgent Treatment Centre, and emergency department, so that we all use the same nomenclature. Unfortunately, it's taken a long time to get that in place. Sorry.
Thank you. Yeah, so it'll probably take another 20 years before we'll probably named all of them maybe again before anybody's got used to UTC anyway. But thank you. It's Councillor Lonsdale next. Thank you.
Hello. Thank you. It's been very interesting. The thing that rings alarm bells for me, however, is the word streamlining. What guarantees is that when you say streamlining, that makes me think, what are we going to lose? Now, we've already talked about it's already over subscribed on so many levels. The NHS, the walk-in centre, I've experienced it a few times with my children, particularly where we've been sitting there. I've sat there with a 3-year-old and a 5-year-old for hours waiting. And if we're going to streamline, you know, that, are you just talking about trying to get things to move faster, or are you going to lose services so that people can't access things? That is my question.
Thank you. I do wonder whether I've used the wrong term by saying streamline, and I suppose what I'm really talking about is trying to simplify the actual system for the public, because at the moment it is still very, very confusing. So that there is no intentions, but it is part of the data gathering, the focus groups, the discussions with people around how well some of the urgent treatment centres are being used. Do we need more of them? You know, are they not utilised at all, so therefore there's no impact? We all know that workforce is a real problem for us across any service. So therefore, would it be better to move those staff into a different urgent treatment centre? That'll all come out of the review process. So I have no... well, I'm saying we have no thoughts that we will lose any of the services at this moment in time, but it is absolutely about simplifying and making sure that you've got the right access points. Yeah.
Thank you. Councillor Grimmadell.
Thank you, Chair. Well, I've learned something tonight, and that it's this committee is 20 years behind the times, because I certainly didn't know that A&E had changed. I mean, it's something new. But also the fact is that I didn't know the walk-in centre had changed its name. And it does say in your report, you may know them as minor injury units or walk-in centres. And I think the majority of people in this city would know the department as A&E, and also the walk-in centre. So that really worries me, that when we talk about surveys and you talk about the names changing 20 years ago, it makes me wonder whether this survey is really fit for purpose. I mean, it's something that I just think, I mean, why have we changed the name? I know it's a simple, I'm going to get a complicated answer for a simple question, but why change the name from A&E when everybody knows it as accident and emergency, and why change the name of the walk-in centre? And also I'd like to know, because I'm a picture of health, I never use a walk-in centre. Is that open 7 days a week, 24/7? And how many doctors are man the walk-in centres?
Thank you for that. I feel like I've come here and I've insulted you all by telling you 20 years behind the times, and I absolutely didn't mean it in that way, I promise at all.
We're all very thick-skinned. We're all politicians. It was terribly tough.
So, but the name changes absolutely were part of the national consultation. It wasn't a case of us being governed by that. It's one of the, I suppose, the directions that have come down to say, can we all use the same language? Because across the country, people had the same type of service with the same specification, but the names of them were very different. And it was to help people if they were going anywhere in the country. It wouldn't matter where they were, they would understand what was in each of these services. I just don't think we've achieved that at all across the country, and obviously by the way that we've communicated, it hasn't reached people at all. With regards to going into an urgent treatment centre, they are not available 24/7. The two co-located urgent treatment centres that are next to the emergency department absolutely are. So you can get access to services there, but all of the other ones close at 10 o'clock at night, and that's due to the really low level of activity. And we've also got our GP out of hours services that run through the night that people can access for any urgent needs as well. Most of them are manned by GPs as well, so there is support there from GPs, but what you tend to find is that it's nurse practitioners, advanced nurse practitioners with skills in minor injuries that are supporting those functions, so a much more expanded workforce.
Thank you, Councillor Froggatt. Okay.
I'm totally confused now. So if, as Councillor Cooper says, he broke his ankle, jumped in a taxi and goes to the urgent treatment care, they would set his bone, or would they transfer him to a, what is it called now?
Just call it that in the middle.
Yeah, or would they transfer him to A&E?
So that depends on how bad the break is, but they do have facilities to do plaster casts and back slabs to make sure that they're comfortable, yeah.
My next question then, bear with me, Chair. EMAS, we know, they deliver to A&E. So if they turn up to somebody who's rang an ambulance because they've got a suspected broken ankle or a suspected broken arm or whatever, do they or will they assess and take them to an urgent treatment centre, or would they just straight to A&E?
Yes, they will. I haven't put that on, but yes, they will. They've all got direct access to the urgent treatment centres, so they'll either take them there themselves, or if the person's able to get there under their own steam, they will advise them to go to that location instead. Yeah.
It's just that I've never heard anybody say they've been taken or advised by a paramedic to go to an urgent treatment centre. They're always taken, well, they're either left at home and told to contact the GP, or they're taken to A&E. So I think EMAS needs to be, spoken to.
If it would be helpful in a future presentation, because it's been really helpful, this discussion, just getting a flavour of where we are. We can provide you the data of direct access from EMAS, just so that you can see that. Yeah.
That would be useful, thank you. Are there any further questions for Berenice? So thank you ever so much for coming. You have had a bit of a grilling actually, but it is really useful because I think that this is actually quite, I think simplifying it, it is desirable. And I think I personally appreciate what is happening, and I think it could be very beneficial. I just think there's an awful lot of work to be done to make it much clearer for people where they should go when they have what problem, because at the moment I think there is confusion. So that I think if you could take that away, and we would like to receive perhaps not at our next meeting in April, but maybe the following meeting, which will be in the new civic year, won't it? Where it may be a completely different committee then, hopefully not completely different, but if you could offer to come back, I think, and give us some further feedback on how it's all going, and those councillors, maybe some of us as well, will be able to feedback further to you, and hopefully it will be a positive progression. Thank you very much. Yeah, thank you. So I'm just going to adjourn the meeting for a moment now, because we need to see if our next presenter is waiting downstairs. So we'll just adjourn the meeting for a moment. Thank you. start, so thanks. Okay, thank you very much. Welcome back to the meeting. Our next report is the mental health post-COVID response from the CCG Derby and Derbyshire, and unfortunately the CCG have not been able to send a presenter this evening. We did consider going through the slides and maybe collating questions in the meeting and sending them to the CCG. But the other problem we have this evening is due to the absence of the scrutiny officer, we can't present the slides. So what I'm going to suggest is that we have the report now. So if members want to, probably already read the report, but if you have any questions at this stage, could you send them to me and Lindsay Stevens? We'll collate them. We'll send them to the CCG and we'll ask for responses to the questions and an updated report at our April meeting. Is everybody happy with that? Okay, thanks very much. So now we'll move on to Clive Newman from the CCG Derby and Derbyshire, who is going to talk about the primary care estate developments in Mikelover and Macworth. Thank you, Clive.
Thank you, and thank you, everybody. Yes, I've got a brief briefing on the primary care estate in Mikelover and Macworth. I think you've seen the paper. It's really an update ahead of, hopefully, a much broader and more extensive conversation later in the year. But we thought it'd be helpful to just update you on where we are with that. You may be aware, we have talked about it, I think, in this group before, that we have completed last year, a primary care estate strategy across the whole of Derby and Derbyshire. Mikelover and Macworth was identified as the highest priority area in the city or the county in that strategy. And we've begun work now to plan for more capacity, more primary care estate, to serve the estimated 16,400 new residents that are likely to move into the area over the next 10 years, and also to provide extra capacity to meet the current demand. We completed a feasibility study. It's quite a protracted process, investing millions in new buildings, as you may be aware. We completed a feasibility study, just simply doing exactly what that says, understanding the feasibility and of the estate, and looking at potential options back in October 2020. And then we followed that last year with a strategic outline case for both Mikelover and a separate one for Macworth, both of which were completed in December. I was going to say last month, but actually the month before last, in December 2021. Those strategic outline cases went through a range of options for both sides. So looking at the current estate and looking at options for new buildings, knocking down old buildings, replacing them, etc. The Mikelover strategic outline case looked at 5 options, and the Macworth one looked at 7 separate options. We've completed that now. It's now being checked, factually checked, by the practices and the participants who took part. It will be presented formally back to the practices in February, next week. Once the practices have had a chance to look at it and discuss it, it will then go to the CCG's Estates Committee, which I chair, and then the Primary and Care Commissioning Committee. Once that is all complete, we'll be able to bring it, we will hopefully have got at that point a preferred option or preferred options for both Mikelover and Macworth. At that point, we'll be able to then start a proper consultation, which will of course involve coming back to this group. I hope that will be in the next couple of months. I think that we'll be looking at the going to the estates group this month, Primary Care Commissioning Committee next month. So hopefully the following month we'll be able to bring it back to this group. But I will need to just check that with colleagues, and obviously it depends on how controversial extensive the conversation is with practices. So that's really the report. I think overall it's positive news. We are progressing well with plans. We have clear plans to add capacity. There will, I think, be new buildings in both Mikelover and Macworth. At least that's our plans. As I say, we're looking at those options, working them through, and we'll be able to report later in the year.
Thank you very much. Councillor Froggatt.
I'd like to say thank you so much for that news. As you know, I am a Macworth councillor. I had heard rumours that one of the options were possibly one in each ward, Macworth and one in Mikelover. I'm hoping this option will be the one that's taken because, as you say, 16,400 new residents within 10 years. I mean, I don't even know where they're going to live because we've got no houses. So, you know, but no, that is really excellent news. Thank you.
Can I just, yes, that is, you're right, correct. We're looking at separate builds for Mikelover and Macworth. We originally did talk about a single, but you're absolutely right. The geography, the population, the capacity needed really meant that we needed to look at them separately.
Councillor Pegg.
As a fellow councillor in Macworth, I want to just sort of reiterate what Councillor Rock just said, that we want one in Macworth. Mikelover is fantastic, but we want one in Macworth. Just to be a bit more serious for a second, to my mind, this has been going on for about 5 years. Is there anything that can be done to speed it up so we can get it done sooner?
Yes, absolutely. I completely understand. Premises developments are agonisingly slow. They can be absolutely glacial. It never is a quick process, particularly not where you're trying to build a new building, potentially move or relocate practices, put practices into new buildings. As you know, I think we've talked about it before, the practices own their own buildings often, so you're actually dealing with independent businesses and trying to encourage them, cajole and support them. So it does take time, and obviously it's millions and millions of pounds worth of investment, and you have to go through due process. But I completely agree, it's very frustrating for us, it must be tremendously frustrating for the residents, and we will do everything we can to move this along as quickly as we can.
Any other questions for Clive? I think so. Basically, it seems like a very positive response tonight from the ward councillors and probably from the committee as a whole that there will be 2 new centres. That's fantastic. As I say, I'd reiterate what Councillor Pegg said. I mean, it's really clear that we just need more provision in the city ASAP, given the level of difficulties, as you came to speak to us before about GP access, didn't you? And that problem is ongoing and in many respects getting worse. So obviously, if that can, I mean, do you have a sense of, I appreciate that it's because of the way GP services operate that it's not, you can't control it centrally as such because they have this independence, which I think dates right back to 1948, was it, the NHS was set up? Or was it 47? Was it 48? Thank you. So that's a historic problem, but do you have any sort of target date when you think they might be coming on stream?
I don't, and I tend to be a bit rash with these things. I'm not going to be rash in this instance because I don't want to raise. I don't know. Normally, you are talking years, so it can be. It depends how quickly you've got your strategic outline case, then an outline business case, and a full business case. All of that needs to be approved. You need to get everybody agreed, and that is what tends to take most of the time. Then you obviously need to find the land, sort out the developer, and build the buildings. And obviously you need to agree the ownership model. So there's quite a few stages. You are talking, 4 or 5 years normally from this point. But I wouldn't want to speculate too much about this particular instance.
Fair enough. And just one further point, if I may, because our next item on the agenda is to note a recommendation from the Executive Scrutiny Board on the Council, which is about bringing climate change issues into all of the scrutiny boards of the Council. So we're just supposed to note that. So in that respect, could you, is there now a commitment, if you're talking about new builds, and we're talking about 5 years' time, I mean, I'm not sure what the government has decided about phasing out gas boilers, but I'm not quite sure what date they placed on that yet, but we are going to, and we have to anticipate the end of gas heating, and we need insulated buildings, etc. Is that part of the? I appreciate you haven't even exactly got a business, the whole thing going yet, but eventually it will. That will happen, and we will have a design for the buildings and the premises. So, is that all? Are you anticipating that those sorts of things being part of the design?
Yes, we are. There's already a national standard to which we're expected to, or we're expected to adhere, and it is quite strict. I'm not an expert in environmental building standards. You won't be surprised to know, but there is a standard that we are expected to hit, and I think that is only going to strengthen over the next few years. So I can't talk with authority about what that is, but that's built into current planning for NHS buildings and will be part of this.
Thank you. And I think we can also see that if you hope the travel to the surgeries should be much less as well if you have one in Mikelover and one in Macworth. So that would also fit in with that agenda which we have been asked to address by Exec Scrutiny. Well, if there are no further questions, thank you very much for coming. We look forward to further updates, and we look forward to hearing of the most rapid progress possible on this initiative. Thank you very much. So item 9 is just to note that recommendation from the Executive Scrutiny Board, which I've just mentioned, which is about bringing climate matters into all of the scrutiny boards across the council. I don't know if there's anything further to be said about that, if anybody wants to make any comments on that. No?
Chair, just briefly, if I may, the flip side of that was also the piece of work that was done for the performance plan for the Executive Scrutiny Board was to look at were there any particular items that it would be more appropriate for individual boards to look at rather than the Executive Scrutiny Board. So it's about trying to reduce the duplication and trying to have items that are relevant to the particular individual boards going to them as well. So what the Executive Scrutiny Board will just have an overview at every meeting of the sort of master work programme for all the individual boards, so there's an oversight, so we can all see what's going to each of the individual boards, if that makes sense.
So you mean, sorry, Chair, so you mean basically the Chair of Exec can look at what's going off in whichever scrutiny it is and pick and choose, go, well, actually, yeah, that meets that criteria, we want to discuss that. Is that what you're saying? And then also on the flip side, the scrutiny committees have first dibs on it as well. Is that?
It just so there's one place with the Executive Scrutiny Board being the overarching board. Just there's one place where we can all see what is going to all of each of the individual boards, because that's easily can get lost within the individual boards, and obviously the work programmes do change, don't they, throughout the year. Some items get taken off and some items added. So what I'll be asking my colleagues to do is if they can just update their work programme so that we've got one document in one place so we can see what's going to each of the individual boards. That's the other side to that.
Thank you for that clarification, Stephen. Councillor Froggatt?
Yeah, I'm just a little confused over that and reading this. The board itself are still responsible for putting their work topic review forward, and if we decide that's what we want to work on, then that's it. Nobody can interfere and say, you cannot work on that one.
Yep, that's absolutely right. That's why this is just a matter referred. It was a recommendation from the Executive Scrutiny Board, and as the chair has mentioned, that they felt that all the boards ought to look at the climate change, particularly to themselves. But yeah, you're absolutely right. It's for each of the individual boards to, if anything, obviously the individual boards can refer matters up and matters can be referred down, but it's to each. It's a matter for each individual board to set their own work programmes.
Thank you. So that's just leads us to our final item, the work programme and the topic review. On the work programme, we do have quite a lot of items, well, 2 items from this evening were deferred at the request of the organisations that were supposed to come along to our next meeting in April. We've now, in effect, also deferred the mental health report as well. So that will be quite a full meeting, the next one. On the we will be having a report on dentistry at the next, and I know, well, we're all very concerned about all the reports, but we've been very concerned about GP access, and also I know we're all very concerned about dentistry. Given that I know, I don't know if it's all the dentists across the city, but most of them have recently written to their remaining NHS patients and removed them as NHS patients. I'm just wondering if in the meantime I should write to, I don't know if it's the CCG or the relevant body, and ask them about this move and the implications rather than waiting to April. So raise this issue with them, ask them exactly what is happening, what the implications are. I don't know what anybody thinks about that. Councillor Cooper.
Thank you, Chair. And I just want to thank you as well. We've had a conversation about the access to dentistry within the city. Both of us share concern about the direction and the impact of COVID over the last few years. It's very concerning. Nothing's more important than anything else. But I think this is something that's going on unseen in our communities and societies. And I think we need to really look into this. And thank you for letting me know that people are removed from dentist lists. I will give my dentist a call tomorrow to find out if I'm still on the list.
Well, you may well be. This is it. I don't know how widespread this is. I know it's happened from several dentists, so I don't know if it's all. So it'd be interesting. If you haven't received a letter, then you probably may still be an NHS pension, I would think.
I've moved house recently, so it may well have gone through the cracks. But yeah, I think the utmost urgency needs to be looked into this. If our colleagues agree, I think even consider maybe even an extra meeting if that's acceptable. But yeah, and also as well, I think we need to start reaching out as high as we can to get some spotlight on this. Thank you.
Okay, thank you very much. So what I'll do is I will, at the very minimum, I will write to express our, we want clarification on what is happening, and express our concerns, and seek reassurances to the extent that they can be given on this, but we need some reassurances. If I will talk to Lindsay Stevens, the scrutiny officer, about whether it might be appropriate to have, say, just an emergency meeting before April on the situation with dentistry. We'll give that some thought. I think it's a possibility, but I'll need to think that through and discuss it. Thanks. Lonsdale?
I don't know if it's appropriate or if it's something that we can do. Is it something we as a board can work along with along the scrutiny board for CYP, because obviously children have been removed as well. So it might be worth bringing up a two-pronged attack here, and saying to CYP that it's, something we'll work together on.
It sounds like a good suggestion that we do, if we're going to get people here of relatively, short time scale to talk about one issue, it might make sense to have a major issue, I must say. It is a major issue, but it is one area of service provision. Does that sound feasible in theory, Stephen?
Thanks, Chair. Yep, I think there's various different ways that meeting could happen, that joint meeting could happen. So yeah, that would be something that you could definitely have a chat to Lindsay about, and yeah.
Thank you. Councillor Cooper?
Thank you, Chair. Good idea, Councillor Lonsdale. If it is a short notice meeting, those of us that may not be able to make it for whatever reason, if there's two committees, hopefully it'll be a good turnout either way. So you've got it's double bubble, isn't it? Don't want to teach you to suck eggs or anything like that, but if you do get in touch with the people about the dentistry at the highest levels within the NHS in the city, would you mind asking early doors how many NHS patients were within the city of Derby, dentistry-wise? How many are on the books, say, in November 2019? How many are there now? And I think that'll give us a real, easy, quick overview of where we are, and then we can start, delving in and looking at what's going on.
Yes, yep, thank you. Yes, we'll do that. And hopefully if we arrange this meeting, we can ask them that directly, but we can present that as one of the area of concern. So we'll do that, thank you. And then there was, on the topic review, we've had quite a few interviews. We're currently writing to bodies that may directly or indirectly represent the concerns of care home residents and staff, to invite them to talk to us. So that's currently in progress. We did speak to the young man from the West Indian Community Centre, and there was a proposal then that we might go on a visit to the West Indian Community Centre. So when Lindsay returns, if everybody's still in agreement with that, I will ask her to set that up so that we can perhaps go on a site visit to the West End Community Centre and learn more about what they do and how they've helped particularly elderly people in the West Indian community during COVID. And the other suggestion, and I think this probably won't be something that would happen very soon given the COVID situation, is that I will talk to Lindsay and the hospital about a possible board visit to the hospital to maybe speak to senior members of staff. I suspect that they don't want visitors at the moment at all, but we could have that on the programme as something desirable to do at a moment when it's possible, if we're all agreed with that. Okay, so any further comments? No? Right, well, thank you everybody for coming, and we'll meet again very soon. Thank you.